Hi everyone, thank you so much for coming to this webinar on the use of AI transcription tools in social care. My name's Oliver, I'm a researcher at the Ada Lovelace Institute, and I'm really excited to share some of our research in this space that we've done at Ada, but also more excited to hear from the perspectives and experience of our amazing panel that we've got lined up. Just so people are aware, we have Katie Thorne from the Digital Care Hub, Kath Ritchie from North Yorkshire Council, Rachel Astle from Beam, and also Ellie Ott from the Nuffield Family Justice Observatory. So hopefully a really good spread of expertise from industry, research, and different parts of the care sector as well. A bit of housekeeping before we start. There is a Q&A function in the Zoom call. If people could leave questions for the panel in the Q&A function, and then reserve the kind of more standard chat function for any technical issues that they may have, and we try and fix those on the call as we go through. We'll start by presenting some of Eda's own research in this space and then move on to a panel discussion where there's an opportunity for you to pose questions to the panelists towards the end of the webinar as well. So the use of AI transcription tools to automatically generate care records based off of recorded conversations with people who draw on public services is becoming increasingly prevalent across healthcare, the justice system, and also social care. And at Ada, we really wanted to focus on the social care application because this is a sector where the use of the AI tools to generate care records is becoming particularly prevalent, particularly quickly. And we really wanted to drill down into social care as a case study to understand the implication of these technologies in frontline public service contexts. So we conducted an 8-month-long qualitative research project into the use of these tools in 17 local authorities across England and Scotland, conducting interviews with social workers who've used these tools in their care work, senior managers at local authorities who have been involved in the procurement and evaluation of these tools, and also experts from industry and academia who have been working on the development and evaluation of these technologies. And we really wanted to understand two things. Firstly, what is the impact of these technologies on care work itself? And then also how are these technologies being adopted and evaluated at a local authority level as well? I think to start off and frame the webinar, I'll hand over to my colleague Lara, who's going to talk us through some of the findings from this research.
Great, thank you, Oliver. Good afternoon, everyone. My name's Lara Groves. I'm a senior researcher at Ada, and I was co-investigator of this project with Oliver. So I'm going to share with you briefly a snapshot of the findings. So there's 3 key takeaways, I think, to bring to bear to this conversation today. The first is that we find that AI transcription tools are really, really useful and can meaningfully help social workers to manage their workload and create better care outcomes. The second finding is that we think that AI transcription tools may have important downstream implications for people who draw on care and social care as a profession in ways that are emergent, and we share some sort of emerging details about that, but we point to the need for further research and practice to ground the picture out more coherently. And lastly, our case study demonstrates the need for further evaluation and oversight of AI tools in the public sector to better enable meaningful transparency and accountability. Next slide, please, Oliver. So just to ground into the research a little bit. So as I say, most social workers we spoke to were really enthusiastic about the benefits of using these tools. We had the phrase game changer a lot, as illustrated by the quote on the right of your screen. So lots of social workers found that AI transcription tools can save them time in their work, but we actually find benefits beyond time saving. We had some social workers who highlighted that AI might improve relational practice, enabling better face-to-face conversations and more concentration, and also strong potential for AI to be used as an assistive technology for social workers that are neurodiverse or have other needs. We also know that AI transcription tools are being used flexibly. Back screen, Oliver, thank you. Social workers tell us that they're using the tools in a variety of different ways according to their needs. So we heard from people co-producing AI summaries with their clients, some who are using the full transcription note of meetings, so they create more documentation, some who are dictating their notes to and from meetings. So it's really enabled a more flexible practice for some of these social workers, which is great. We did get some social workers who say they were not comfortable using AI for everything that their work might require, in particular, something like a Care Act assessment or something with a statutory underpinning, as you can see on the quote on the right. But a lot of social workers told us they're really happy to experiment, or indeed were encouraged to experiment with AI by their employing local authority. Next slide, please. However, it's clear that AI may impose additional responsibility on social workers in ways that may impact them and the people they serve. So we did get quite a few people who reported various inaccuracies, which are known as hallucinations in the space of generative AI. And this was particularly prevalent in children's social care, interestingly. So that ranged from everything to the more benign names being transcribed incorrectly to a more serious case where a transcription tool hallucinated that someone had suicidal intent when this was actually never discussed. There also might be subtle omissions from AI-generated transcripts that are a bit harder for social workers to catch at the basic user level. There are questions remaining about what effective human in the loop looks like and what oversight looks like at the level of social workers. It's not really clear empirically in a range of different contexts how much time social workers should spend reviewing AI-generated outputs. Additionally, there may be insufficient second defense quality assurance going on in local authorities to help catch errors as local authorities begin to address the advent of AI. Practices may not have kept up with pace, and we've had a lot of variation in this area across local authorities. So we made recommendations in the report that will need probably independent additional evaluation capabilities to support local authorities, as well as academics and AI vendors. Next slide, please. So there's no consensus that's fully emerged yet on when it is or isn't appropriate to use AI transcription tools, particularly in those higher risk contexts. So as I mentioned, some local authorities told us they decided against using AI for anything statutory like Care Act assessments. Others felt more confident doing so, but this creates a really mixed picture at the aggregate level in absence of systematized guidance in the space. Inter-agency meetings came up a lot as being possibly subject to complications with the advent of AI. So there's differing governance practices between social care, justice, and healthcare at the moment. So we learned that most police forces have actually banned AI transcription tools at present from being used. And we also know that social workers that might be using AI in a more shadow fashion are often left to their devices, definitely their own devices, sorry, to make critical decisions about when to use AI, which may put them at risk. Next slide, please. And final finding to bring to bear today is that current evaluations of AI transcription tools may not consider systemic impacts. We know that evaluation approaches can be a little bit patchy, particularly for local authorities that are or have not been undertaking a pilot of magic notes, as Beam have their own teams to support local authorities with evaluations and co-production. So many local authority staff told us they really struggle to do their own testing internally beyond very rudimentary measures. The most common type of evaluation that local authorities were testing for was this time-saving measure on throughput. But some told us that they actually were simply measuring whether AI was being adopted and how often it was being used. So the more qualitative metrics like worker well-being or public trustworthiness have often been deprioritized for resourcing reasons. We also know that there's very little longer-term evaluation going on, either in local authorities or in academic research, that is looking at phenomena like automation bias or de-skilling. Great, I will wrap up there, and I think we're going to move over to the panel. So thank you, everybody.
Great stuff. Cheers, Lila. Yeah, moving on to the panel, starting with Katie. I'd really appreciate it if you could introduce yourself a little bit and talk about your experience supporting care workers with their use of AI tools at the Digital Care Hub.
Thanks, Oliver, and thanks, Lara, for that. Good afternoon, everybody. So, I work at the Digital Care Hub. We're a not-for-profit, and we support adult social care providers, so many care homes, home care, supported living providers across England around technology, data protection, cybersecurity. We're technology agnostic, so we don't sort of endorse products or say you must purchase something. We very much more around sort of supporting through peer networking and empowerment about what the options are. And for the last 2 years, I've been doing work with the Institute of Ethics and AI at Oxford University and Casson Consulting, looking at what the responsible use of generative AI would be for social care. When we started this work, to be clear, it didn't cover transcription tools. They were starting to be piloted, but weren't really broadly there. We kind of were starting with some of your free Gen AI models, ChatGPT and similar. But it has obviously broadened as we've seen more AI being used across social care. What's been really interesting, so we've done a lot of work really focusing on sort of the concerns, needs, sort of opportunities for frontline care and support workers. And we've had some really clear themes which have come from them. So we're talking here specifically about the non-regulated workforce, particularly domiciliary care workers. And what's interesting when we talk to them about their use of AI is that generally speaking, we do see a lot of shadow AI usage. They have sort of clear requirements from employers that they should be told when they can and they can't use a variety of different AI tools. And that's quite often still not in place. So people are using a variety of different AI systems without their employers knowing about that. So there's very little oversight there. Um, then, when we're talking more about systems which are being introduced by care providers, by local authorities, by their employers, we see a variety of different sort of concerns coming through. So, one is really a concern around, is this going to replace my job? We hear that a lot. Normally, when you explain sort of what the systems are doing, that fear does fade, but there's sort of some of that human change, cultural change model that really kind of seems to be falling between the cracks a little bit here. We also see a lot of people really concerned about liability, particularly concerns about, if the AI tells me to do something and harm befalls an individual, or if it misrecords something and I miss it, is that the responsibility of me as a care worker, or is that the responsibility of my company, my employer, senior leadership, or is it the responsibility of the technology company? And, I think that some of these questions are things which came through in your research as well, particularly where you don't have like a robust sort of training in place around the introduction of some of these systems. Um, and something which I think is quite interesting as well, we get particularly from the domiciliary care workforce. They're quite often the people who are most frequently interacting with people who draw on care and support. They can be a really friendly face. And so more and more they're having conversations with clients, with their service users, where the service users are asking questions about how AI is being used in their care, not necessarily by the domiciliary care worker, but say the social worker has said, oh, well, we're trialing this new system. And then the client has come back home and has said, oh, I was told I was using this and I don't really understand it. And they're kind of being expected to have quite complex conversations about AI usage when they are not necessarily particularly well skilled in it themselves, which in positive cases can actually have like a reassuring feedback loop. I think there's a real opportunity there for sort of meaningful conversations about it. But where you may have a workforce who's already quite skeptical about it, particularly if those fears about being replaced or liability haven't been addressed, you could actually end up having a bit of a barrier there where you go, oh no, you should make sure you're not using AI. And I think that's something we maybe haven't picked up yet as a system.
Thanks, that's really interesting. I think there's a lot to go on there, particularly around
Yeah.
liability.
Yeah.
Um, Kath, I'd be really interested to hear a bit about your practical experience at North Yorkshire Council on your use of AI transcription tools there.
Yeah, hi. Hi, thanks, Oliver. My name's Kath Ritchie. I work for North Yorkshire Council, and I am a transformation and innovation manager. So we do lots of innovation, and of course that means AI. And my background is adult social care, so I've been in and around and adjacent to social care for a couple of decades now. So it's a real area that I'm passionate about supporting. I In my current role, I work right across the organisation. So in terms of this use case that we're talking about today, that includes adult social care, children's social care, homelessness, customer services, anyone that's having that kind of conversation and needs to write it up and may benefit from some sort of digital scribing. And we look across the board at different kinds of tools as well. But I guess in terms of sort of social care and transcription tools, what we did is we started with people and asking them what they want. And as Katie said, there's a lot of anxiety. You know, people are concerned about their jobs, they're concerned about their professions, they're concerned about letting people down. And I think, say about 18 months ago, there was lots of headlines around kind of Copilot replacing social workers and organisations that got rid of like 500 social workers. And, you know, that piques the interest of people, especially people that are balancing their budget. So really, people were scared and anxious. So instead of trying anything, we started with a social care discovery day, and we had probably about well over 200 people came in person to just talk about social care and what AI might mean for them. And everyone came in that room like super anxious and like quite defensive. And then it all kind of calmed down as we explained what AI was. We listened to their anxieties. We gave them some examples of sort of things it could do. And then we said, right, what do you want us to do with it? And then people went from that high anxiety to calming down to getting really quite excited. And at one point, I actually had a queue of people talking to me like, I want to do this, I want to do this, I want to do this. So from there, we knew what people felt anxious about, but also what the big thing was that they wanted help with, and it was documentation burden to get us away from these computers, from these whirring screens, and get us back on people's couches talking to people. It was such a clear message, and they'd seen the examples of how it would work, and it felt very comfortable right on the day. And what we heard even on that day was that this would help them do their day job, but it would also help them stay in the profession. We have people saying, I'll stay longer with this. I won't talk my daughter out of entering this profession because of these kinds of changes. And also I'll progress to management because I'm not so scared of this extra documentation burden. So what we talk about in North Yorkshire is we don't talk about AI, sort of human in the loop. We talk about AI in the loop. Humans are always in control, always at the helm of everything. But when do we want to bring AI in to help us to get rid of that slog, but definitely not get rid of the skill? And actually, having worked for 20 years in this area, this is the first time I've seen some proper change in this field, and proper change that adds value, that's exciting, that's going to give back to this profession and make it more professional. So I think, and you might have gathered I could speak for a very long time on this, but I'll just sum up. I think there's 3 things that we could think about. One is to do an ethical impact assessment. It's one of the most powerful tools that we've got. It had those issues that Lara touched on of managing transparency and accountability. It brings them out to the fore, and it says what we're going to do about it, how we're going to manage, how do we build the practice that goes along with these tools to make it right. The other thing is there is a risk, accept that there is a risk, but there's also a risk in what we do now. And we think there's a far greater risk of just saying, no, we're not going to do this. Absolutely not. Both because this can really help. So it might still have risk, but it's better than it is now. But also, if we don't engage, we're going to build this whole skills chasm of inexperience where people then can't catch up. So we need to be able to keep pace. And then the final bit is there is real excitement here. There's so much good. And actually, social care as a profession and the people that work in this field can teach the rest of the world how to do this really, really well. If we think about what we need is ethically informed practice that balances risk and always puts humans at the centre. Well, that's what social care have been doing for years. So they're ideally placed to get this right for us. I'll stop there.
No, thank you so much, Kath. That's really interesting. I think there's a range of knock-on benefits from these tools, like you were saying, and also, definitely challenges with the status quo, and it's about balancing those trade-offs completely. Ellie, can I turn to you to introduce yourself and talk a little bit more about the broader implications of using these tools in the family justice system?
Sure, great. Hi, it's lovely to join you all. I'm Ellie Ott. I'm Associate Director for Research and Data at the Nuffield Family Justice Observatory. And we've recently released kind of an update on our briefing around AI in the family justice system. So that's on the website if anyone wants to take a look there. I have been leading research around children and families for a long time now, well over 15 years, mainly around children's social care. And my wife and I are also foster care, so I'll reflect on that a little bit in some of my discussions and thinking about the implication of transcription tools for the broader family justice system. Because indeed, our fostering agency has recently rolled out magic notes, and so they're using it in the supervisions with us as well. So I think there's 3 main implications for the broader system I wanted to talk about. The first is really understanding where data and information is coming from. So that involvement of where is the person. So Kath was really talking about starting with the social workers and that being part of the decision making. So understanding where are the social workers coming, that kind of human in the loop. And I will say, as a foster carer, I have had reported, and I know that sometimes the accuracy of information isn't there along the change. So the way in which my notes have been changed and interpreted, including within a courtroom, have been inaccurate. So there are existing inaccuracies, but there is also that great concern from transcription tools because we know they hallucinate. So when have they been checked? When have they been used? How has that been used in decision making around whether or not care proceedings should be started, and a judge's decision making around the family justice system? Do they know where transcription tools and AI have been used and are part of the records? So is there a way for us to make that clear? Is there a way in which people can make it clear when they check the information and how they check it? So there's that aspect. Then really importantly, the report raised the question around the evaluation of transcription tools. And hopefully this is something we'll talk a little bit more broadly about in the Q&A. But the evaluation should not just be about accuracy and not just be about time efficiency, so accuracy in one specific use, but we really need to look more broader and think about the outcomes for children and adults who are part of the care system. And we need to look systemically at potential for systemic biases as well as benefits. And then thirdly, I think following that, there's the question around what are the implications broader for the trust in the family justice system and the trust in social workers. So is the use of transcription tools, is it allowing for a better relational practice? Is it building up the trust in the system, or actually is it undermining that trust? So we've consulted with the Family Justice Young People's Board, and they don't want lots of AI used. A lot of the young people with experience of the family justice system don't want AI used with them because they want kind of that human interaction. So that's quite interesting in thinking about the implications for trust. So those are my 3 points. I would just encourage, because I know there's quite an active webinar chat, and as panelists, we can't, I think, contribute to that. I'm really keen to have your questions and answer them. So I'd encourage people to put questions within the Q&A button as well.
Thanks, Natalie. I think that's a really good articulation of just what we mean by systemic implications as well in the research. And I think you've kind of raised those concerns really well. Rachel, finally, moving on to you. Could you talk us through how Beam went about creating an AI transcription tool specifically for application in social care and the kind of considerations that you made in that process?
Yeah, of course. Hi, everyone. I'm Rachel. I'm Chief Commercial Officer at Beam. We are the company that built Magic Notes, which is one of a few tools that the report looked at. I guess, how did we build Magic Notes? Firstly, we didn't go about trying to build an AI transcription tool. That's not where it originated. Like, we started with a problem that we needed to solve within our own team. Beam, for those of you who don't know, started as a service delivery organization. We have a big team of caseworkers who support people who are homeless to access jobs in homes. And we were really experiencing the problem that's really at the heart of a lot of this discussion, which is that documentation is really essential, but it also pulls practitioners away from the human interaction, which is what matters actually most in their work. Whether that's when you're with a person, you've got your head in a notebook trying to scribble things down, or that you're spending most of your time, as Kath just described, at your laptop, at your computer, trying to catch up on admin during the week. And so initially, Magic Notes was built to try and address that problem within our own team. But it worked pretty well for our team to be able to spend more time with the people that we're supporting. So we began partnering with councils to build a social care specific version. And that's probably the most important principle about how we approach building Magic Notes and how we continue to build it today, is that we're not a hands-off kind of software company. We work very much side by side with organizations, from designing those very first versions through to all the iterations we're building now. There's probably 4 themes that I'd like to just mention that are really important to us in how we build. So the first consideration is that like this tech for social care needs to be really domain specific, not general purpose. And I think the report highlighted this really well, that like context matters here, and application specific tools can be much more suitable than like a general tool like a Copilot, which is fantastic for a meeting that you might have, but maybe doesn't make sense in social care. There's a lot to this, but everything from guardrails in the back end to flag safeguarding risks, reduce bias, increase accuracy, like run evaluations, structured outputs that actually make sense for the setting that you're in, but all the way through actually to real world considerations. And here you're looking at things like working in quite noisy environments, dealing with multiple accents, languages, lots of different speakers, no internet access. Like there are so many things that go into making these tools effective and accurate and safe in a social care context that that we have thought about and will continue to think about with our partners. The second theme people have touched on, but is really around keeping humans at the center of this. Like we have not set about to automate professional judgment. This is about giving people the time and space to spend time on human judgment and human care. And in order to do that, I think you do have to think about the product, from how you make citations really easy so that you can actually check information quickly, all the way through to integrating with best practice as an organization, so that as a social worker, you can quickly check like what would best practice in North Yorkshire Council look like for this particular feature. And now those kind of things can help a practitioner like realize the benefits without being kind of overwhelmed by new technology. The third is around implementation, and I know Kath and others will speak much more to this because they live it every day, but I think it's really important that you don't kind of throw this kind of technology into a team and walk away. So from our perspective, that's looked like working really closely on rollout, from training to consent processes to evaluation, which I know we'll touch on. And that needs to be an ongoing process, not just a kind of one-time exercise. And then lastly, like we have worked really openly and transparently with our evaluations. So we've run more than 200 pilots in social care settings now. Each of those has had a structured evaluation, which means we've had something like 5,000 people kind of take part. But we've also worked with academics like Rob Proctor at the Alan Turing Institute, and then also put magic notes through a public deliberation exercise to get the views of the general public and people accessing social care on the tool. And those things are all accessible and continue to shape how we build. So I guess combined for us, that means like this is a work in progress. So that's how we've approached building the tool as it is today. But I expect it will continue to evolve both as the technology evolves, but also as we learn things as a group. And that's why these discussions are so valuable to us.
Thanks, Rachel. I think it's really great to get that detail on how the tool kind of developed and iterated on over time. I've got some general questions for the panel that I'd like to pitch, starting off with Ellie, I think. I think we've already heard from what people have said and also Laura's presentation that there's a range of different benefits that these tools can bring to social care, both social workers and also people who draw on care. Do you have an inclination as to, is there a particular benefit we should be aiming for with the use of these tools, and how should we go about kind of determining how people benefit from these tools?
Yeah, so it's really lovely to hear the different speakers and talking about the theory of change for the tool and the tool in different contexts. So I think it's important that we look at outcomes for the theory of change, and the ultimate outcome being improved outcomes for children and adults who use social care. So that starts out, for most contexts, probably really thinking about, is the tool improving the time usage? So the report covered a lot around efficiencies, but how is then time usage used? Otherwise, is it used for that kind of increased relational practice? Is it allowing greater job satisfaction? We know we have real issues with retraining social workers, for example, in these contexts. And then going on to think about how is that relationship then affecting the relationship between social workers and children and adults within the different systems, how is this affecting decision making, and is it ultimately leading to better outcomes, including really, I think it's important to look at well-being. I'll also add that's really important to look at equity. So to look at what we know in terms and we don't know in terms of for whom transcription tools are working the best, and concerns around biases as well, which I know that some of that has been raised in different reports. So I'll stop there because there's lots of interesting questions, but really I think we ultimately need to look at the outcomes for children and young people and adults.
No, definitely ditto to that, focusing on outcomes for children and adults. Katie, can I ping that question to you as well about the different benefits from AI transcription tools?
Yeah, absolutely. So I agree with Ellie. I do think it's very much about outcomes at the end of the day. And so my work's been sort of in adult social care, not with children, so maybe a slightly different context. But I do think that the reports we're hearing sort of from people who draw on care and support quite often, who've had experience with using AI transcription tools, is that they have found that in some cases this has made them feel more closely connected to a social worker. They feel that there isn't a computer or a screen sort of between them. And so you actually have more of a conversational style conversation. And I know for social workers in the report, they stated that as well. That obviously means that they feel that it's been well explained to them how the system is working. And so I think there is a potential benefit there in terms of having a more relational experience for them. But I also think it's interesting what Kath was saying as well about how you could then have transcriptions from both sides. And I do think there's potentially a benefit around empowerment for people where they can see a transcription of what they said. They can match that with what comes out in an assessment or what enters into their record, and they can maybe feel that they have more input there. I think that needs to be evaluated, but like that is something I could see as an area. There's been quite a few comments, I think, in the Q&A in the chat as well about what we mean by workforce efficiencies, and sort of so where there are these benefits around, potential time saving in writing up notes, is that time being released to actually then give social workers more time back to review the case notes, to really think it through, to have that really important part of their practice? Or is that going to be a way to basically add to people's existing caseload? We're like, oh, you need less time now for this, so we'll give you an extra X number of people to work through. And I do think there is a real tension there in terms of what it means for social workers and for people as well, if we're just using these tools as a way to sort of try and get through waiting lists much faster, which I don't think is how they've been designed in general, but it may well be how they've ended up being used.
No, that's really helpful and makes a lot of sense. I think definitely that question on evaluating the different benefits to identify those tensions is really important. If I could turn to Kath maybe to talk a little bit about evaluations of these tools and how do you go about kind of measuring the different benefits that these tools can bring to care work?
Yeah, no problem. And I agree wholeheartedly with what Katie and Ellie have said. And it's so important to think about what the real benefits are before we start working out how we're going to track them. But I think there's something about pace. This, as has been said, it's all a work in progress. It's all happening. So we do have to get going. That doesn't mean we just have to let it wash over us and just just deploy these tools for everybody. So I would say we need to start, but we can start small, and then where you like something, where it adds value, then you can scale it from there. I would also say that you absolutely need teams led by social care practitioners or housing practitioners, not transformation or technology types. When I do innovation, proof of concepts and things like that, I want it to be 80% service, and then we're there just to kind of help make things happen. I do think when we're measuring something, we do have to be honest. It's really easy not to be when you're trying to write a compelling business case or scenario, but these tools can and do save loads and loads of time, but that's not our time to reclaim. In order to support this kind of wonderful workforce, we need to give them this time back, and focus on how we can enhance well-being, make caseloads manageable, and help people connect at a deeper level. This all benefits the workforce, and so we can help retention, all those other elements. So, but we need to be honest, so we can track time. And that's absolutely a measure that we can do, but we need to make sure we don't then immediately try and monetize that time. I would say that one of the ways to absolutely measure the impact is by keeping in touch. So regular meetings, we have a monthly benefit squad meeting, we have weekly check-ins with our Beam, and then when we're looking at helping people adopt and train, we work out when we can do that, when's the best time in the calendar, and we do kind of big push adoption support in terms of how they want it, you know, one-to-one training, classroom training, that kind of stuff, whatever people want. So it's about keeping in touch with people. And then by doing that, you can define the metrics that matter. So co-produce that with the people that know and align them to the stuff they're already measuring. Don't make them do something else. They're already looking at quality. They're already looking at numbers. They're already looking at throughput. They're already looking at retention and all that kind of stuff. So just see how these new technologies can support what we're already doing. You know, this is not a profession that stands still. They're already looking at continuing professional development and how to constantly get better and serve people to a higher degree. So we just need to lean into that, I would say, and lean into those teams and tools and ways of doing that already. And if you're looking at new tools like digital transcription and Magic Notes and other ones, then see how they contribute. And if they don't, we need to really challenge that. But ultimately, it's like you got to listen to people, keep getting their feedback, keep asking for it, and don't just listen to the happy stories. Give space for people to say, I feel anxious about this, or look how bad it was, it went wrong, and then dig into it and find out why. So keep asking. You know, I went to an ADAS conference recently, and there's a carer who is an absolutely wonderful expert by experience. And she stood up in front of the whole room and she was like, I don't really know what Magic Notes is, but I'm really excited about people having it so that my social workers can really listen to me. And you just think, you know, that voice was really exciting and really compelled us to move forward. And then we've also got children's social workers who actually you know, they use Magic Notes in practice, and then they get the transcription and the outputs, and then they work with the children to say, what do you think? And I think that's where practice will go, that the last 10 minutes of the conversation is, does this look like an accurate record? Are we all happy? And so those conversations, you know, it's not so much metrics, it's hearing people's stories as well. So yeah, and again, I think that social work and homelessness and these people that work in this field are absolutely ideally placed to help us track the impact of these tools, because they do. They're using them every single day.
No, that's amazing, Kath. Thank you. Really, really interesting. Can I also ask Rachel that same question about measuring different benefits of transcription tools? Because I know obviously Beam support a lot of evaluations of the Magic Notes tool on the ground as well.
Yeah, sure. Big plus one to everything Cass said. I mean, especially like encouraging people to be really open about what's not working and what's not. I mean, there's the obvious reason why you would want that. I would say from our perspective as well, like some of the biggest leaps forward we've made in the product have been from those conversations with practitioners where they've said like, this thing like wasn't very good, or like, why can't we think about this? And it's not helping me with this problem. So I think that underpins everything, that people know it genuinely is an evaluation where their feedback is going to make a difference. Yeah, I mean, a few kind of practical thoughts, like definitely agree, like you need to define it up front as quite a multi-dimensional thing that you're trying to evaluate. Like, yes, the time saving is a really important component of that. But there are so many other facets to how these tools can impact work. There's quality of documentation itself, like consistency, language, accuracy. You're not kind of relying on a couple of bullet points that you scribble down and try to remember 3 days later. Quality of care, and there you've got to look at both, you know, how the practitioner feels, how the supervisors might feel, and then importantly, how the residents might feel. And then workforce experience. And, you know, I think we would all agree social care is one of the toughest professions to be in. And so can these kind of tools have any impact on that, positive or negative? So once you've kind of like recognized that, I think you start to quickly see that the way you can effectively measure and evaluate is by looking at workflows, not kind of tasks. And I think that's been like an evolution in how we've thought about this, that you can relatively simply measure, like, how long did it take me to write up this type of meeting previously, and now what does it look like? But the really interesting thing here is to start thinking about how that shows up across like a whole workflow and a whole experience for a resident engaging with social care. Is it fewer follow-ups? Is it smoother handovers, coordination between agencies, effects on waiting lists? Like, there are so many different ways that these things can show up. And so it's complex, but evaluations that can look at end-to-end workflows are really insightful. You obviously need to combine quantitative and qualitative data to do that. And one of the hardest things we've found is having enough resource to be able to get enough qualitative input from people accessing care. And that's something that we definitely want to do more of. And then secondly, how do you evaluate these things over a longer time period? Obviously, there's an element of these tools have only been around for quite a short amount of time, so the body of evidence is still growing. And I know, Ada, one of your kind of calls in the report is for like kind of more pilots and evaluation. I think we build on that a bit and say like, let's go beyond the pilot and do like more longer term evaluations and think about how we measure the kinds of impact that's quite hard to measure in the short term, like staff retention, the obvious one. We've got lots of wonderful quotes from people saying this is helping them like feel more sustainable in their jobs. Is that going to actually play out over the long term? I don't know. But we've got to start measuring it if we're going to see whether it will.
No, definitely +1 to kind of longitudinal studies. I think that's something that we're really keen to ask for as well. I think something that's coming out as well is including the perspectives of people who draw on care, not only in evaluations, but also in these, conversations like the one we're having today about more generally the use of these tools in different contexts. So if I could come to Ellie, first of all, about how can we kind of meaningfully include the perspectives of people who draw on care in these kinds of discussions?
Great. I think there is, I think the first thing is just to ask them, and there's a lot of ways in which to ask them. So there was a really good example there from North Yorkshire in thinking about using transcription tools and going to a person with experience who was really excited about the opportunity in terms of listening for them. So I think there's the question in terms of the how do we roll out transcription tools, and in which contexts in which we can consult with existing groups. So most local authorities have a children in care council, for example. And I spoke earlier about the Family Justice Young People's Board, who are very good at articulating the concerns and opportunities, and very, very articulate themselves. So I would encourage people to consult with them. An interesting, there's also other groups like Family Rights Group, and a lot of these existing groups will have kind of trauma-informed ways of working, and well as ways of working in which we can ensure that it's really participatory, and we can try to listen and hear to them. So I would encourage people not just to consult them, but have that help inform decision-making around transcription tools and decision-making about maybe expectations for how summaries are reviewed or recorded. And then one thing that I've noticed is popping up in the Q&A and chat is that question about how are people consenting to the use of transcription tools. And this is an aspect I haven't looked at specifically myself, but as a foster carer, I was asked to consent to the use of magic notes and made very clear that the social grist would still meet without the use of magic notes. But I was able to use Ada's report to highlight some of the concerns around hallucinations, but also know that there's opportunities for me as a foster carer, because normally they'd be quite distractive in trying to type notes or spend a lot of time typing notes afterwards, or the lag between the meeting and the typing notes, knowing that could introduce other biases. So I was able to raise the concern and the real importance of checking the summary itself and of having that more open conversation and dialogue. But likewise, young people, a lot of adult users, it's really dependent on how much they can consent, but they often really can understand and consent. So I would encourage those conversations to happen as well, so that everyone is informed and there's that consent for use of transcription tools.
Thanks, and I think there's a lot to pick up on there, particularly on building what already works well, like the Family Justice Young People's Board. We're not starting from scratch. I think is important, maybe a positive way to look at that. Moving on to questions from the Q&A then. I think one thing that's coming up quite a bit is questions about trust. and the impact of AI tools on trust in social care. So could I move to Katie maybe to talk about that? Is that something that you've thought about in your work?
Yeah, absolutely. I think it's something which has come up time and time again in the work. And I don't have access to the general chat, but I did. There is a link there. So TLAP Think Local Act Personal did a piece of work last year with people who are long-term users of social care, sort of talking about priorities around use of AI and their expectations and experiences. And that might be a helpful report for people to read. In general, in a lot of the work that we've been doing, we found that people who already have had very poor experiences of social care are less likely to trust that AI is actually going to improve their experiences in any way, whereas people who've had more positive experiences of the system already were sort of came in with a baseline level of trust that AI would continue to improve that. So a lot of the conversations that we've had then has been like, okay, where trust is about trust in the system as a whole, as well as trust in a particular form of technology. How do we then actually bring people on a journey with us to sort of first redress the initial trust issue in social care, and then to say, and this is a way that technology can either support that or sort of maintain like a better experience and outcomes. That can be quite an in-depth conversation, I think, for people. And that's part of that whole consent conversation, which Ellie was touching on as well. And sort of in the adult space, that's been involving conversations around what does meaningful consent look like to sort of maintain that trust? How can we be open and transparent with people? Like, can we have an ethical framework support some of that decision-making conversation? And how can we reassure people about their rights to opt out of having AI used as part of their care if they have concerns? Some of those conversations can be time consuming. I think that came up in your report as well, that actually those initial conversations with people might be a lot longer than you might initially have to have at the beginning of an assessment with somebody. I do think they are worthwhile. But I think it's something that we time and time again have like had conversations about this. There's also people who are mentioning about capacity and where people have fluctuating capacity or no capacity. What does that mean? And I think it can be quite easy to default to saying, well, we use the Mental Capacity Act, we do best interest decisions as we would for anything else. But actually, is that something which is appropriate to something we haven't looked into specifically? But I do think there is scope for sort of further work there as well.
No, thanks, Katie. Definitely, really interesting. Again, we say these tools are socio-technical, so they're introduced, so technical systems introduced into social systems, and you have to address both simultaneously, really do it right. Question for Rachel from the Q&A, if that's okay. Someone has asked about any issues with kind of AI-generated inaccuracies being occurring in records. One way to kind of address those concerns is to store and maintain the original recording and transcript so that it can be referred back to in case there's any kind of he said, she said as records progress through the care system. Does that happen consistently, and how is it done with Magic Notes?
Yeah, it's a really interesting area. So the best way to think about Magic Notes is it's a notebook. So the recording and the transcript are not kept long term. So every organization has their own retention policy, but typically they're deleted within about 30 days of the conversation happening. So those things are not kept long term. But I touched on it very briefly earlier, but being able to check the accuracy is something that's really, really important. And there's a lot of tools that you can build into the product to make that easy, but also make it quite front of mind so that people are more likely to check all through the details. So citations is an obvious one where you can see like this is why we have this sentence and it links directly to a point in the transcript so that you can check the details. But also bringing through kind of checks against what kinds of topics you might have expected to cover in that conversation. So for example, if you were having a foster care conversation, you might have wanted to cover various topics about that child's well-being. And if something wasn't covered in the conversation, then you can have prompts that kind of bring through like, was this covered? We can check the transcript and we can have a look. Or maybe that was missed in the conversation entirely and maybe the practitioner might want to go back and cover something again or add a bit more context if it simply wasn't recorded. So there's some of the ways that we think about this, but we don't keep recordings long term and use that to train any models or anything like that. It's quite a transient kind of system.
No, that's really helpful. Thanks for clarifying. There's also a question about the specific models that Magic Notes use as well. If you could briefly kind of address that as well.
Yeah, so you can find all of this information if you, I will put the link in the chat. It's our Trust Center. So we use OpenAI models as our base models, and then Scribe by 11 Labs for accuracy. But you can look at our data architecture and our security accreditations and all that kind of stuff on an open website, which I can't multitask. I'll find it in a second and post it in the chat.
I'll let you have a breather whilst you do that then. There's also a question for Kath in the chat as well about managing staff's expectations around the use of AI tools. One person is hoping to roll out an AI transcription tool following a pilot and would be keen to have kind of learnings from your experience on that particular issue.
Yeah, it's interesting because you'll have the whole gamut of what you've had on this conversation you'll have in terms of staff expectations as well. Despite the name, this stuff isn't magical. You know, it is wonderful and it's real game-changing stuff, but it doesn't just happen by magic. You need that practice guidance. You need ways of building it in, as you've said, that kind of socio-technical approach. And you need to work with the hearts and minds of your whole staff group. Some of those staff group will be chomping at the bit. What we've learned from the sector is that actually people are talking to each other. This is not a change for North Yorkshire Council and another council. This is a step change for the profession. And so they're talking to each other. So you'll have staff that are like, why haven't we got this? We want it, etc. Bring it now, that kind of stuff. We've got more people using it in children's than we do in adults at the moment. And so we've got adults saying, why have they got it? We want it, etc. etc. So a lot of excitement. So the expectation is really high. The people that come with that kind of attitude tend to have a really great experience because actually they're open to it, they want to learn, they give it that kind of investment of time at the beginning. And once you've done it and used it for a little while and built it into your practice, then the benefits are very quickly laid bare. Obviously, there's other staff expectations of it being continuing to sort of exacerbate those worries and anxieties around taking over people's jobs and professions and upsetting or disrupting that relationship that you build with people. I saw a comment in the chat about my social work, should be the social worker should be listening anyway, and absolutely, of course they can and should be listening, but if they've got their head in a book and they're typing and writing up as well, or typing straight into a computer, then it's harder to engage with the person and pick up on the visual clues that are going on around as well. So the expectations will be, I think, now are very high. I think we've got to a tipping point where actually the vast majority of people in these professions want this tool, see the benefits, speak to other people using it, and are just eager and ready to go ahead. They'll also have expectations of really poor relationships with technology suppliers. We have a duopoly of very big tech that dominates this field, and they're not overly responsive to individuals, for example. And so they won't expect good hands-on training and being able to just kind of work with the system and make sure it works for them, and iterative developments at the pace that they're getting at it now that we're working in the world of AI and cloud and things like that. So we need to raise people's expectations to expect more from our suppliers as well.
Thanks for that, Kath. Really helpful. Another question for Ellie around the position of courts and the use of AI in the generation of care records. Is there a position of courts and judges on the use of these tools?
So to my knowledge, there's no position on that. I'm on a working group around AI and family justice and other things. There's different pilots happening on the courts with other uses of AI other than transcription tools. So there's no kind of policy or anything at the moment. I think it's an important question. And then there's also that question of, do we have some sort of watermark or acknowledgement whether different AI tools have been used and how they've been used and how they've been checked. So there's different law discussions in the family justice system itself, but no policy of my knowledge.
No, yeah, I'm not surprised, but thank you for kind of giving some clarity on that. Katie, there's a question about accessing more support for using AI tools. I think it's from someone who sounds like they might be a practitioner. Could you talk a little bit about that as the last question for the panel?
Yeah, of course. So there's such a huge range of AI tools we hear quite often from practitioners that are struggling to keep up with sort of the pace and scale of the different ones which are available. So in England, local government association has been doing quite a lot. They have a whole AI hub now where they're sharing information there. We have resources as well in the Digital Care Hub, which are free to access. And DSIT, Department for Science, Innovation and Technology, have just launched a sort of range of AI e-learning. I have not personally tested those out, but they're free to access. Social Care Wales has done a lot of work in this space as well. They have did a lot of work with local government and adult care providers looking at AI. I think I now have access to the chat, so very happy to put some links in there. They really focused on case studies in particular, which might be really useful. And I know there was a couple of questions about Wales in the Q&A as well, so there is work happening there.
Great stuff. Thank you, Katie. I think we're going to start wrapping up now as we approach the end of the hour. We've received a lot more questions than what we what we have time to answer here, unfortunately. So I'm going to send my email address into the chat, and I'm very happy for panelists to do the same if they're happy to do so, or I can field questions and pass them on to panelists later on. But yeah, really keen to continue the conversation moving forward. If anyone has any resources that they want to share or any of their own work that they're interested in sharing, would be really keen to pass that on. And yeah, just to reiterate, thank you so much, everyone, for coming, and an especially large thank you to our panelists as well. I think I've given some really amazing insights from their very different experiences on this topic. So thank you very much, everyone. Cheers, I appreciate it.